Hi everyone, this is Pia Gwenny Colrocolas, a first-year nursing student from Davao Doctors College, and today I'll be doing a cardiovascular assessment. So a cardiovascular system is the system of our bodies that supplies oxygen and nutrients which are needed to do our daily activities. So doing a cardiovascular assessment will help us to identify factors that could affect our cardiovascular health, such as high blood, hypertension, diabetes, and some other stuff that is both common and uncommon. Now, let's proceed for the pre-introductory phase. Review the client's medical record and the doctor's sheet. This is done in order for the nurse to know the previous medical history of the patient and to provide focus on the physical assessment of the patient. Now, determine the scope of assessment needed and prepare the necessary equipment. This is done to conserve time and energy. So the pieces of equipment that I'm going to use are the stethoscope, to auscultate for heart sounds, the 8 inches ruler to measure for the jugular veins, the rectangular cord, and the examining light for a tangible light source. Now, perform hand washing and don glove if necessary. This is done to prevent the spread of microorganisms. Now, greet the client politely and his or her companion if around. Introduce yourself and verify the client's identity using the agency protocol. Ask how the client would like to be called during the assessment and establish rapport with the client. This is done to ensure that we are assessing the right client. Now, explain the procedure to the client and how he or she can participate during the assessment. Provide the client the opportunity to ask, to clarify or raise any concern. This is done to elicit the cooperation of the client. And after that, ensure the client's comfort, privacy, and confidentiality. Make sure that the assessment setting was assured to be safe, secure, and free from distractions. And also position the client in a comfortable setting position. Good morning, ma'am. How are you today?
I'm fine.
Okay, so I am Pia Gwenny Colrocolas from Davao Doctors College, a student nurse. May I see your wristband, ma'am? And can you please state your full name and date of birth?
Jude Victoria Olivar, February 27, 2008.
Okay, so how would you like me to call you, ma'am?
Joe.
Okay, Jode. So Miss Jode, I'll be with you for your cardiovascular assessment, and with that, I'll be touching some parts of your body, and I'll be palpating for your neck, your peripheral limbs, your arms, and your legs, and I'll be auscultating for your heart sound. Will that be fine with you? Okay, so do you have any questions or clarifications before we proceed to the assessment?
None.
Okay, so rest assured that the information that I'll be gathered today will remain confidential and only be available to your healthcare professional, including me, okay? Okay, so I'm going to position you now, ma'am. Okay, Jude, how are you feeling right now? Are you comfortable?
Yes.
Okay, would you mind if I close the door? Is it okay for you? Okay. So, it is done so that no one from the outside will be able to disturb you during the assessment, okay? Okay, so I'm going to position you now. So, can you lay down here, Jode? Okay. And this, here's a blanket. I'm going to drape you for your privacy. For that, how are you feeling today?
I'm fine.
Alright, so have you experienced any shortness of breath, Jode?
No.
How about dizziness and headaches?
No.
So have you had any history of heart diseases?
No.
How about anyone from your family?
No.
Okay, so do you smoke, Jode? Okay. Thank you, Jode. Okay, Jode, so I'll be at your right side. I'll be closer at the right side of your neck. And I'll only give you a uric line around 30 degrees to promote normal breathing during the procedure, alright? Okay, Jode, so can you, for a minute. Okay, so you can, back now. Alright, Jode, so I'll be shining my pen light to check for your neck. And can you tilt your head toward your left side? Okay, so to the right side, Joe. Thank you so much, Joe. Alright, Joe, so your right external jugular vein is flat, and also your left external jugular vein without sunshine. And if ever I have found any distinction, I will have to locate the highest missile point of the extension of the internal jugular vein. And if needed, I could also lower and raise the bed to help the observation of the extension, okay? Okay, this time, Joe, I'll be measuring for your jugular venous pressure by measuring the sternal angle or the right angle using this ruler and the rectangular cord, okay? So on the other side, Joe. Thank you so much, Joe. Okay, this time, Joe, you're going to tilt your head on your left side because I'll be palpating your carotid artery, okay? Okay, so can you tilt your head? On your right side, Joe. Okay, thank you so much. So now I'll be auscultating for your carotid artery using the bell of the stethoscope so that I can hear the low pitch sound because I'll be listening for your breath sound. So what I want you to do is to tilt your head on the left side, and then you're going to inhale and exhale, then hold it, okay? And then as well as on the other side, okay? Hold it. Then on the other side. Hold it. Okay, thank you so much, Joe. So I haven't found any carotid root bilaterally on your carotid arteries on the left and the right, okay? I will be sitting here for the next assessment. Okay, we're going to inspect and palpate. Okay, for the next part of the assessment, I'll be inspecting and palpating for your pericardium on the chest area. And I'll have you to expose the drape. So one chest after the other, okay? So can I drape now? So I'll be inspecting on your chest, so your aortic, pulmonic, tricuspid, and apical areas, okay? I'm going to use my pen line. Okay, so thank you, Joe. Now the first thing, I'll be palpating for your hips. So I'll be placing my fingertips completely on your sternal border and under the apex, alright? So I'm going to insert my hand and palpate it. Okay, thank you, Joe. So this time, I'll be palpating for your thrills or the vibratory sensation caused by underlying turbulence, okay? I'll be using the ball of my hand to palpate, alright? Okay, Jude, so can I insert my hand now? I'm just using the balls of my hand. Okay, Jude, so I haven't found any vibration this time. So this time I'll be palpating for your aortic, pulmonic, and tricuspid areas, okay? Okay. So permission to insert my hand. Alright, so I already checked for your impulses. So this time, the next impulse will be the apical impulse. So I'll be palpating for the apical area using my 3 fingers. So if I am unable to palpate for any impulses in your apical area, so I'll be needing you to move or roll towards your left laterally, okay? I'm going to palpate. So, can you move towards your left jaw? I'm going to palpate your apical area. Okay, so I'll be palpating for your apical impulse again. And if I'm still unable to palpate the apical impulse, I need you to inhale and exhale fully and then hold it. Inhale. Exhale, and hold it. Okay, thank you, Jode. You can roll back now. Okay, Jode, so even if we haven't found any impulse in your apical area, there is no problem since it is completely normal not to feel any apical impulses, alright? So this time I'll be palpating for your epigastric area. Now with using my 3 fingers. It's right under the sternal border. Okay, so I'm going to insert my hands now. And I'm going to palpate them, okay? Okay, so I already done it. I'll be covering you now with a blanket. Okay, this time I'll be auscultating for your heart rate and rhythm using the diaphragm of my stethoscope, and I'll place it on the apex area of yours, okay? So I'm going to insert my stethoscope. I'm going to use the diaphragm. Alright, so your heart rate and rhythm is completely normal or regular. Okay, Joe, this time I'll be auscultating for high-pitched sounds on your aortic, pulmonic, and tricuspid and apical areas, alright? So can I lift the blanket now, Joe?
Sure.
Okay. Okay, Joe, so I'm going to listen now. Alright, so now I'll be listening now for low pitch sound, but I'll be using the bell of the stethoscope, okay? So I'll be doing it now, Joe, okay? Okay, thank you so much, Joe. Okay, Jode, so I'll be repeating the steps earlier, but this time, Jode, I need you to face laterally on your left side, and I'm going to remove the drape. Then you're going to inhale and exhale, then hold it, alright? So I'll be assisting you. Can you face laterally over there? Can I remove the drape now? I'm going to listen using the diaphragm of the stethoscope. Inhale, exhale, then hold it. Inhale, hold it. Inhale, exhale, hold it. Inhale, exhale, hold it. Inhale, exhale. Okay, so I'll be repeating the steps, but now I'm going to use the bell of my stethoscope, okay? Inhale, exhale, then hold it. 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 Okay, thank you so much, Joe. Okay, Joe, you can relax now. So in a supine position, I'm going to cover you with a blanket. Okay, for the next part of the assessment, I'll be assessing for your peripheral vascular system. I'll be moving to your upper extremities to the lower extremities. So, Joe, can you put your arms on your side? Okay. So, I'll be inspecting for the size of your arm, its symmetry, and also the skin color and temperature. I'll also note if there are presence of edema, any skin lesions, changes in skin color, and hair distribution. Okay, on the other side. Okay, thank you, Jod. Okay, so your arm is same size on the other arm. It's also symmetric. The skin color is normal, and the temperature is warm to touch, which is considered normal. There is also no presence of edema, lesions, changes in skin color, and hair distribution. Okay? Okay, Joe, can I have your arm? The other side. independent position of limbs, there is an extension of the veins, and when it is elevated, the veins collapse. Alright, so this time I'll be palpating for your radial, ulnar, and brachial pulses. Okay, so first is the radial, then the ulnar, then brachial. Okay, can I have your arm? Okay, thank you so much, Joe. Okay, so the pulses are normal and symmetric. Okay, now I will also be checking for the capillary refill of your nails. Have your arm. The other side. Okay, so the capillary refill is less than 2 seconds, which is considered normal. Okay, Joan, so for the Allen test, I'll be needing you to close and open your hands as quickly as you can, alright? Okay, so I'll be assisting you to move closer here so that I can reach your other hand. Okay. Alright, so can I have your hand? Then close and open as quickly as you can. Then I'm going to remove my hand. Okay. Okay, thank you, Joan. So on the other side, quickly as you can, open, close. Getting my hand. Okay, thank you so much, Joe. Now, Joe, let's proceed to the lower extremities. So first, I'll be assessing for your peripheral vascular system on your lower extremities, alright? So I'm going to observe for the size of the leg, the symmetry, skin color, and the temperature. I will also check for the presence of edema, lesions, changes in skin texture, and hair distribution. Okay, Joe, so I'm going to up the drape now. Thank you. So Joe, your leg is the same size on the other leg. It is also symmetric. The skin color is normal. The temperature is warm to touch, which is considered normal. And I haven't found any presence of edema, lesions, changes in skin color, the hair distribution. And then an independent position of the limbs, there is an extension of veins, but when it is elevated, the extension collapses. Pulses. Alright, so this time I'll be palpating for your pulses. First is your femoral, then your popliteal, then dorsalis pedis, and then the last one, the posterior tibialis. Okay, so I'll be checking for your femoral pulse now. Okay, Joe. Then for your popliteal, Joe, can I get the drape now? Okay, so the dorsalis pedis, and then the posterior tibialis. And then on the other leg, for the last one, I'll be performing a Human's test. This will be used for checking the deep vein thrombosis. Alright, so can I lift the drape now? Okay. Okay, Jode. Okay, Jode, so what I'm gonna do is to dorsiflex your leg. So your foot to check for your calves and then the other leg. So I'll be checking also for the capillary refill on the nails. Okay, so I'll start now. And on the other leg. Okay, I'll also check for the capillary refill of the nails. Okay, I'm going to cover now your body. And then, okay, so capillary refill is both less than 2 seconds bilaterally, which is considered normal. Alright, Joe, so we're done with the assessment. Thank you so much. Now I'm gonna assist you to a comfortable setting position. And now I'm going to summarize all the pieces of information I gathered today, okay? Okay, so when you do this, like this. Okay. So, and then you'll go into face there. Alright, Joe, so I'm going to summarize it now. Alright, so all your vitals are normal, and I haven't found anything that indicates abnormality related to your cardiovascular health. Alright, so if you feel anything unusual later, you can push the call button for the nurses, alright? Okay, so do you have questions or clarifications before we end the assessment?
No.
Okay, so thank you so much, Joe, for your full cooperation, and have a great day ahead, okay? Now, document findings in the client record using printed or electronic forms or checklists supplemented by narrative notes when appropriate. This is Pia Gwenicol Rocolas, a student nurse from Davao Doctors College. Thank you so much for watching, and God bless us always.